Hello, everyone, and welcome to Pharmacology Minis, where we'll be breaking down concepts related to pharmacology in nursing. Today, we're going to talk about the introduction to pharmacology and pharmacokinetics. To start off, what's the difference? Pharmacology is the field of medicine that studies how chemical agents affect biological systems. Different things that we think about with pharmacology is whether it's a natural or synthetic chemical, the mechanism of action, side effects, adverse effects, interactions, and contraindications of medications. Pharmacokinetics is the study of how drugs move throughout the body. This involves drug metabolism in the first pass metabolism, excretion, absorption, distribution, half-life of the medication, the peak and onset and duration of the medication, the therapeutic index, and receptor binding. As far as pharmacology goes, the chemicals can be natural or synthetic. Natural means that it's natural occurring within the world. This could be things like your vitamins and your herbal supplements. Synthetic chemicals are those that are made in a laboratory and are often the medications that are produced by a pharmaceutical company. The mechanism of action is how the drugs produce an effect in the body, and the effect is affected by things like age, body weight, gender, genetics, biorhythmic cycles, tolerance, which is when you require more of the medication to produce the same effect as your body gets used to the medication, the psychological state, which we'll talk about more when we talk about placebo effect, somebody's diet, their medical problems, and accumulation of the medication. Side effects are negative effects from taking the medication at a therapeutic dose. It's generally non-threatening and very manageable and does not require discontinuation of that medication. Whereas an adverse effect is a negative effect that comes from taking the medication at a therapeutic or a higher than therapeutic dose. This can be serious and life-threatening and often requires discontinuation of that medication, as well as significant medical management. Interactions are the enhancement or reduced effectiveness of a medication when mixed with another medication or food. And contraindications are factors that make it unsafe to take the medication. A big example of a contraindication that we'll talk about as we break down the different medication classes is pregnancy. The mechanism of action is based on whether the medication acts as an agonist, an antagonist, or a mixture of the two. An agonist binds to a receptor to cause an effect. This effect may be similar or enhanced by another medication. An antagonist blocks receptors to inhibit an effect. So a medication can be used to inhibit the therapeutic medication from binding and causing an effect within the body. A partial agonist binds to receptor and only causes a partial effect, whereas an inverse agonist binds to receptor to cause only a partial blockage of the effect. In order for a receptor to bind to a medication, it has to have a good fit. As you can see on the left, there's different types of fits that the medication can have with the receptor. The first one is called the lock and key, where the medication has to have the exact same shape as the receptor in order for it to match and bind. An induced fit is where the medication can actually change the shape so that it can bind to the receptor. And then conformational selection, the receptor will actually change shape to bind to the medication. On to pharmacokinetics. Drug metabolism is, again, how the medication breaks down in our body and has reduced effectiveness. First pass metabolism occurs when a medication is mostly inactivated by the stomach and intestinal contents. This is something that we need to consider when giving medications, because if we want the medication to target a certain part of the body, but most of it becomes inactivated by the stomach or the intestines, then we have to find an alternate route to administer that medication so that the most effectiveness can get to the part of the body that it needs to. In drug metabolism, an enzyme catalyzes the reduction of medication effectiveness. It is mostly done by the liver, but can also be done in the kidneys, the lungs, the intestines, and the blood. And the factors that affect drug metabolism are very similar to the factors that affect a drug's effectiveness. Excretion is the elimination of medication from the body. It is mostly done by the kidneys, but can also be done by the lungs, the liver, the intestines, and exocrine glands. An example of an exocrine gland would be breast milk. Absorption is how the medication gets from the site of administration to the bloodstream, and the rate of absorption determines how quickly the medication has an effect. Distribution is how the medication is transported to the site of action, and it is affected by things like circulation, permeability of the cell membrane, plasma binding protein. Therapeutic index is the range of medication it takes to have a therapeutic effect. If it's a narrow therapeutic index, that means that there's a very short window between the medication becoming effectiveness versus toxic. Medications with a narrow or a low therapeutic index are much more dangerous to take and require frequent monitoring of the blood levels. Medications with a high therapeutic index have a wide range where it is therapeutic and a wide range before it becomes toxic. So these medications are often safer and do not require monitoring. The half-life is the time it takes for 50% of the medication to leave the body. A short half-life is typically between 4 and 8 hours. What this means is that the medication would fully leave the body within 8 to 16 hours. A long half-life is 24 hours, meaning that it would take about 48 hours for the medication to leave the body. Because it stays in the body longer, you do have higher risk for toxicity with medications that have a longer half-life. The peak is the point when the medication is most effective in the body. The onset is the point that the medication starts to take effect in the body, and it is affected by the route of administration and the absorption. The duration is the amount of time the medication is in the body and has effectiveness. All of these factors come into play when we talk about how we schedule medications. We want to schedule it so that it continues to have effect in the body, but before it becomes toxic. The different types of absorption that we have is oral. That would be like taking a pill or a liquid and swallowing it. Sublingual goes underneath the tongue, whereas buccal goes in the side of the mouth by the cheeks, and it's absorbed by our glands in the mouth. Mucous membrane absorption can be done vaginally or rectally. Inhalation can be done through the mouth or the nose. Intradermal are topical medications. Subcutaneous is an injection that goes into the subcutaneous tissue. Intramuscular is an injection that goes into the muscle. And intravenous goes into the vein, typically through a catheter. Now on to pharmacology and pharmacokinetics across the lifespan. We have to take special consideration when prescribing and administering medications to those that are children, older adults, or within certain categories of life like pregnancy. As far as children goes, we calculate the dose based on their body surface area. Children have a less developed liver and kidney function, so they typically handle medications inconsistently and differently than what we see in adults. They do have decreased first pass metabolism, so some medications are more quickly utilized by the body. And they also have different physiological structures that impact medication absorption. These are things like having high water content within their body, lower blood pressure, decreased blood binding protein sites, and increased effects on the CNS. So typically we're going to use lower doses for most medications. Some medications, children may need higher doses. In older adults, we see an increased gastric pH, decreased gastric motility, decreased blood flow, decreased kidney and liver function, decreased blood binding sites, blood protein binding sites, and decreased body water and fat concentration. What this means is that absorption is often impacted in older adults based on their physiological structure. In addition, having decreased kidney and liver function means that they have a harder time metabolizing and excreting the medication. So it is a lot easier for older adults to experience toxicity from medications, requiring us to start at a low dose and slowly increase it. In pregnancy, we need to consider the different pregnancy FDA drug classification for the medications to determine if it's safe for both the mother and the fetus. And we also need to know these categories for lactation to determine if it's safe to take the medications while breastfeeding. The categories are category A, which is where controlled studies in humans show no risk to the fetus. B is there have been no controlled studies that have been conducted in humans, but in animal studies, it showed no risk to the fetus. Category C is when there have been no studies conducted in animals or humans, so we don't know if it's dangerous to the fetus or not. Category D is there's evidence of human risk to the fetus. However, the benefit may outweigh the risk, and that's something that both the pregnant person and their provider would need to determine. And then category X are ones that show in controlled studies in both animals and humans that it can cause fetal abnormalities, and the risk in pregnant women outweigh any possible benefit. And that is it for Pharmacology Mini number 1.